Good afternoon. This is Carlo J. Tugade. I will discuss to you the theory of goal attainment by Immanent King. The objective of this presentation is to discuss the theory of goal attainment, the theories beyond this theory, the major concepts, the clinical case study, the nursing meta paradigm, and the strengths and weaknesses. Let's get to know the theories. She was born on January 30, 1923 in West Point, Iowa. She was the youngest of the 3 children. She completed her diploma in nursing from St. Jude Hospital School of Nursing, St. Louis, Missouri in 1945. She received her master's degree from St. Louis University in 1957. She obtained her Doctor of Education from Columbia University, New York in 1961. From 1968 to 1972, she became the director of School of Nursing at Ohio State University, Columbus, in which he made a book entitled Towards a Theory of Nursing, a General Concept of Human Behavior in 1971. This book has been awarded by the American Journal of Nursing as a Book of the Year in 1973. In 1961 to 1966, he became the professor of nursing at Loyola University in Chicago, where he made a master's degree program based on nursing conceptual framework. From 1966 to 1968, she became assistant chief of research Grand Brandt Division of Nursing in USA Department of Health, Education, and Welfare. In 1972, he became the professor of Loyola University Graduate School. She has almost 50 years of nursing experience. Let's now discuss the theory of goal attainment. According to King, the mutual goal setting between the nurse and the client is based on the following: nurse's assessment of client concern, problem, and disturbances in health. Nurse and client perception of interfaces. The sharing of information whereby each function to help the client attain the goal interface. This is the diagram showing the theory of goal attainment. The nurse, perception and judgment regarding a condition or a problem. There will be an action, and there will be a reaction. Same with the client. There is a perception and judgment regarding a concern. There will be an action and reaction. They will combine each other, producing an interaction and transaction. There are so many concepts and theory of goal attainment. Let's start with the concept of nursing. According to King, nursing is a process of action, reaction, and interaction whereby nurse and client share information about their perception in nursing situation. The nurse and client share specific goals, problems, and concerns and explore means to achieve a goal. The concept of health according to King. Health is defined as a dynamic life experience of human being, which implies continuous adjustment to stressor in the internal and external environment through optimum use of one's resources to achieve maximum potential of daily living. The concept of individual according to King. Individual are the social being who are rationalized and sentient. Humans communicate their thoughts, action, and customs and belief through language. Persons exhibit common characteristics such as the ability to perceive, to think, to feel, to choose between alternative courses of action, to set goals, to select the means of achieve goals, and to make decisions. The concept of environment according to King. Environment is defined as a background for human interaction. It is both external to and internal to the individual. The concept of action according to King. Action is defined as a sequence of behaviors involving mental and physical action The sequence is first mental action to recognize the presenting condition, then physical action to begin activities related to those conditions, and finally, mental action is an effort to exert control over the situation combined with physical action seeking to achieve goals. The concept of reaction according to King. Reaction is not physically defined but might be considered to be included in the sequence of behavior described in the action. The concept of interaction. Interaction is defined as a process of perception and communication between the person and environment, and between the person and person represented by verbal and nonverbal behavior that are goal-oriented. The concept of transaction and perception. Transaction is a process of interaction in which human beings communicate with the environment to achieve goals that are valued. Transactions are goal-directed human behavior. Perception is defined as each person's representation of the reality. The concept of communication. Communication is defined by King as a process whereby information is given per person to another, either directly in face-to-face meeting or indirectly through telephone, television, or written words. The concept of rule. Rule is defined as a set of behavior expected of a person accompanying a position in a social system. That rule defines the rights and obligations of a position in relation with one or more individuals interacting with specific situation for a purpose. The concept of stress. Stress is defined as a dynamic state whereby a human being interact with the environment to maintain balance for growth, development, and performance, or energy responses for the individual to person, object, event called stressors. The concept of growth and development. Growth and development can be defined as the continuous changes individual at the cellular, molecular, behavioral level activities, the processes that take place in the life of individual that help them move from potential capacity for achievement of self-actualization. The concept of time. Time is defined as a sequence of events moving onwards to the future, a continuous flow of events of successive order that implies changes, a past, a future, or the duration between one event or another, as uniquely experienced by each human being. The relationship of one event to another. The concept of space. Space exists in every direction and it's same in all directions. Space includes the physical area called the territory. Space is defined as the behavior of those individuals who accompanied it. Let's now discuss the nursing meta-paradigm by King. King defined nursing as a process of action, reaction, and interaction whereby nurse and client share information about their perception in nursing situation. The definition of nursing in nursing meta-paradigm and the theory of goal attainment are interrelated on each other. Let's now go with health. Health is a dynamic state in life cycle, illness interfaces with that process. It implies continuous adjustment to stress in the internal and external environment through optimum use of one's resources to achieve maximum potential for daily living. The definition of health in the nursing meta-paradigm by King and the concept of theory of goal attainment are also interrelated. Nursing meta-paradigm with environment. Environment, an undertaking of ways that human beings interact with this environment to maintain health was essential to nurse. Adjustment to life and health are influenced by individual interaction with the following. Say withdrew with the environment. The definition of environment in nursing meta-paradigm and in the theory of goal attainment are also interrelated. Definition of person. Person in their needs differ in their needs, wants, and goals. They are unique and holistic and our intrinsic worth and capable of rationally thinking and decision making in more situations. The definition of person in meta paradigm and the theory of goal attainment are also interrelated. Let's go now to the diagram of the theory of goal attainment. This is the theory of goal attainment. This is the nurse and the patient having perception, judgment, and action, the reaction, the interaction, and transaction. And these are the concepts that's been defined in the theory of goal attainment. The nursing health environment, individual, action, interaction, reaction, transaction, communication, stress, rule, growth and development, time, and space. That's the diagram. Let's go now to the case study. This case study happened in a district hospital. Patient A is 50 years old, married, were admitted in Hay District Hospital on March 4, 2011 with a diagnosis of appendicitis and underwent appendectomy done on 04/2/2011. Data collected are addressed the following areas. The client perception of the situation as follows. Client said, I have undergone surgery for appendicitis. My wound is healing. I do not have any other issues. I am hurting at the surgical side. My perception of the situation, our client underwent appendectomy operation on 04/02/2011 for appendicitis, which he kept untreated for a month. Client has problem related to maintain of health. Client is at risk of infection development. Client has pain and surgical side. The nursing diagnosis. In nursing process, the data collection by an assessment is used to derive nursing diagnosis. According to King, in process of this goal attainment, the problem is identified by the nurse, concerns and hindrances about who should be approached for help. These are some of the nursing diagnoses. Acute pain related to surgical incision. Risk for infection related to surgical incision. Deficient knowledge regarding the treatment and home care. Health maintenance and ineffective. Planning. Post-diagnosis, intervention planning for problem-solving done in goal attainment by setting the goal and making the decision and agreeing on the ways of achievement of goal. Planning is presented. Transactions, this part and participation of the client encouraged in decision making on the means of the goal attainment. Goal identification, achievement, planning for goals. In the traditional nursing process, planning is harmonious with these steps. I think the following goals are in the best interest of the client. The client will feel comfortable, as evidenced by reduced pain and able to sleep and rest. The client will have no infection and evidenced by normal vital signs. Client will acquire sufficient knowledge about care at home and the treatment. Lastly, client will attend to health problem properly. These are the strengths and weaknesses of the theory. The strength first. The King theory of goal attainment does describe a logical sequence of events. For the most part, concepts are clearly defined. Although the presentation appears to be complex, King theory of goal attainment relatively simple. King formulate assumptions that are testable hypotheses for research. The weaknesses. King theory contain inconsistencies. She indicates that nurses are concerned about the health care of group but concentrated her discussion on nursing as a current in a dynamic relationship. King says that nurse and client are stranger, yet she speaks of their working together for goal attainment and of the importance of health maintenance. The major limitation in relationship of this characteristic is the effort required of the reader to shift through the presentation of conceptual per work and the theory of repeated definition to find a basic concept. Another limitation related to the lack of development of application of theory in providing